name is Rich Romanell, and I'm one of the fourth-year fellows in Pulmonary Critical Care Medicine at Emory University.
Hey everybody, I'm Ankita Agarwal. I'm one of the third-year Pulmonary Critical Care Fellows. I'm also the Chief Fellow for the year of 2020. And we're here to tell you a little bit about why both of us chose the research track at Emory.
So I initially decided to go on the research track in my second year after falling in love with severe asthma. And I knew that I wanted to incorporate research into my practice, and having a very niche area of focus for both my clinical endeavors and research pairs nicely with the added training that I was able to get here at Emory in the research space. And ultimately, I hope to have a subspecialty clinic where I can use my clinical observations to inform long-term research projects.
I knew I wanted to do research when I was interviewing for fellowship, and Emory's program was really one of the few programs that allowed me the flexibility to have an open mind, come here with very few notions of what kind of research I wanted to do and where I wanted to see myself following fellowship. They also were very gracious in giving time for research to fellows who had never done a lot of research or didn't have a lot of experience, and I really valued that. I really wanted the chance to have dedicated research time in fellowship to really see what it meant to be a physician scientist and to see if that's something that my future career could hold for me.
So I am currently working in the lab of Dr. Francis Eun-Young Lee, who is a B-cell biologist here at Emory, who's done work in long-lived plasma cell biology and vaccine responses. In her lab, I've examined the development and characteristics of IgE secreting plasma cells, and specifically IgE secreting plasma cells in tissues, and specifically a nasal polyp. All of that has changed since the pandemic, and we're now one of the labs that are working on B-cell responses in SARS-CoV-2 infection.
For my research, it's a little bit different. I'm doing research in clinical critical care medicine. My mentors are Dr. Jonathan Savransky and Dr. Craig Cooper-Smith. And for my project, we've designed an observational study looking at provider workload and burnout in the ICU and hoping to show an association between the two. As part of my project, which is starting this summer, I'm going to be doing the Masters of Science in Clinical Research. It's a 2-year degree program with 1 year of classes and then 1 year of thesis defense, which is just one of the many opportunities that I've had here at Emory for my research. One of the other opportunities that I've had is actually the chance to present my research at the Society of Critical Care Medicine's Discovery Network meeting at the NIH. It's an annual meeting they hold in the fall, and it gave me the chance as a very junior fellow investigator to present my research to a lot of bigwigs really in critical care medicine, get their feedback, really be bolstered by their enthusiasm for my project. And I've actually come out with a couple of mentors outside of Emory that I can talk through who've been where I've been maybe 5, 10 years, 20 years ago.
And one of the really important opportunities here at Emory that I wasn't aware of when I first came here was scientific collaborations with other institutions, and even institutions here in Atlanta. Our lab does a lot of next generation sequencing and single cell RNA sequencing, and without colleagues in bioinformatics, that research really can't progress in exciting and meaningful ways. And my partnerships through the Georgia Institute of Technology, bioinformatics department have allowed to really explore my data in ways that I never thought possible. And even within Emory, the Department of Immunology and other mentors and early career investigators who, like Ankita said, have gone before us and have been able to help us, have been really instrumental in my development.
So thank you everyone for listening to why we chose research here at Emory. If you have any questions, please let us know. We'd love to hear from you, and we hope you choose to come down here. Thanks.
Thanks.